fellow students. My name is Ricky, classmate in A&P and Dr. Vazzoli's class. As you can see, our lecture today is going to be about nutrition. As you can see from my other classmates, we've talked about nutrition and their importance, especially in a healthy person. But what happens when nutrition needs are beyond the control of a healthy person? For example, I am a critical care nurse and also I work in hemodialysis. Nutrition does go hand in hand with these type of patients. So other than just staying away from the bad fats, fried foods, junk food, it's a little bit more important for the right foods for the patient. Now when I say the right foods, we learn that in nutrition that the function of healthy kidneys is to remove waste products and to remove fluid. So you're asking me, okay, I'm okay right now, but right now I'm pretty sure you know about hypertension. Hypertension is a silent killer. Hypertension usually causes other organs to fail by the time it's too late. One of the first organs that it does hit, other than the heart, is the kidneys. Now, you ask me, why are you talking about hypertension and kidney failure? Well, the reason why I'm talking about this and nutrition is because whenever our kidneys are not working properly, they're not excreting what they're supposed to, and they're not retaining what they need. So when we have an overload of the yummy foods, of Doritos, Carl's Jr., and even a simple Powerade, a big size from Circle K. Yes, these are all fluid needs. And they are good in moderation. But we have to look at what's a kidney-friendly plate. So this is why nutrition is important for kidneys. As you can see behind me, protein is 7 to 12 ounces daily. Fruit, 2 to 3 servings. Starches, 6 to 12 servings daily. Non-starchy vegetables. And look at that fluid right there. That little cup that says 32 ounces a day. Can you imagine just having 32 ounces a day of fluid when you're on a restricted fluid intake? So, what happens when you're on a restricted fluid intake? That means you have to moderate throughout the day how much fluid you do take, whether it's just water or it's other drinks that can contain sodium. Now I know that everybody talks about Powerade and electrolytes, and yes, these are good for you. But if you ever actually look at the labels, they do have sodium in them. And where water follows, sodium follows. So, again, hypertension. So what we try to do is we try to prolong the life of a kidney patient. Now how do we do that? Yes, there is treatment of dialysis, which I will get to shortly. In our last lecture, our professor did speak about dialysis, and we did spend a good amount of time talking about the kidneys. So, when our kidneys are not working, this is our artificial kidney, right here. So usually people have to use this at least 3 times a week for about 4 hours a day until they get a kidney transplant. And usually that lasts anywhere between 6 to 7 years, and it depends if there's a compatible donor. So what we try to do is not only do we try to prolong life, we try to prolong the quality of life through diet changes. So, yes, nutrition is very important. Now, when I say nutrition is very important, one of the things that our professor did touch on, and I'll bring it up here, is let me see here. There it is. So, the evidence with protein energy wasting. We can live without carbs. Yes, everybody's on the keto diet. Everybody tries to not eat bread. But one thing that our body cannot live without is protein. So one thing that we do push here in dialysis is protein. Now, for example, protein here doesn't always have to come in a milkshake. There's always a few options. There's prescriptions. There's prescription bars. I'll run those through you. So, for example, and excuse my laptop for moving because I do have a lot of things to show. Some of these things you may be familiar with. We do have dialysis shakes here that have 18 calories from the protein. This is mocha, vanilla. Most people are familiar with Nepro. Again, these are shakes that we try to get into our patients. And I'll explain why protein is also important for our patients. Not only to rebuild what's trying to be preserved, but also not to waste. We also have protein bars here. I have protein bars flavored in cinnamon, strawberry, which is one of our top sellers, and fudge graham. And if our patients don't like to eat these type of things, we have protein drinks, which are concentrated in these little packets. We mix with sparkling water or water, and we try to get these into them while they're receiving treatment. So, nutrition is also important, not only in protein, but you're also saying to yourself, okay, what about vitamins and minerals? So, for example, when our body needs calcium or vitamin D, the kidney goes through what we learned in the endocrine system. The endocrine system has a response called a humoral response. So, for example, when the body is not getting enough calcium, it takes away from the bones. And when our bones become depleted of calcium, they become brittle. So we can't live without brittle bones. So to kind of counteract the humoral activity of the endocrine system, we give vitamin D, which is hectorol, because we don't want the parathyroid to be overactive. When our parathyroid is overactive and there's too much calcium to be built up in the blood, we don't want our patients to have hypercalcemia. When we have hypercalcemia, not only do we have brittle bones, we also can meet other problems such as certain arrhythmias. So there's other medications, says Cicalate, which is a calcium absorber. These right here are in certain strengths. These strengths right here, which our patients do, we educate them to take them before eating because they become a binder. So whenever they do make what we learned from the digestive system, they bind with the food and then they're able to be excreted. Now, what is also important with the kidneys? Now, vitamins and minerals do play a role, even if they're coenzymes. For example, the kidneys are important for red blood cell production, which is why we have epogen here. Epogen, yes. So you say, why are you talking about epogen and the kidneys if you're talking about nutrition? Well, this is where the patient has to take iron. Iron, remember, is what binds oxygen to hemoglobin. So these are very important medications for our patients to be taken. And usually when our patients cannot take protein, either orally or by supplements, we have to get in another route. And no, it does not go through a kidney route. As we learned about the heart. Now, what do we learn about the heart? We learned about the anatomy of the heart, and we learned about the functions of a heart. But when our patients get dialyzed here, not only is dialysis important for the structure of the heart and knowing the anatomy, but it's also important for nutrition. Now you ask why? Is because this right here, this medication is called Propylite. This is Propylite. Propylite is an infusion of protein that goes in through an IV. Now, it just does not go through any IV, such as if you were to go to a doctor and get blood drawn. It goes through a special IV, the one similar to the IV that they get for their port for dialysis. So, everything kind of goes hand in hand. If you think about it, here's your heart. Here's your IV. As you can see here, there are two ports. One of them is a venous side, and one of them is an arterial side. Now, if we look a little deeper into the heart, we see that it goes into the top of the subclavian. Now, if we just open up the heart right here, we can see this plastic tip that I am moving up and down. Now, if we remember our anatomy, it goes from the subclavian into the right atrium. Now, this is important because our dialysis patients do receive long-term dialysis treatment and nutritional support. So this goes hand in hand. So overall, nutrition is important, not only for the healthy and the young and the people that are still developing, but our sick people as well. Now, not many people think about how much actually nutrition does play a part in healthcare, but it does. Especially whenever our bodies are compromised and we're waiting for a kidney. Now, like I said, sometimes a list for a kidney can go up to 7 years, and given that they do have a kidney, that is if the transplant is successful. Now, when I say successful, just because you get a kidney transplant, sometimes, as you learned in immunity, sometimes the body can reject it. So, the overall prevention with kidney care sometimes is beyond our control. Sometimes people get kidney injury and they're able to recover. Sometimes people go lifelong chronic kidney injury where they're waiting for a transplant or they have to receive hemodialysis for the rest of their life. Either way, nutrition does play a part in it because, like I said, one of the primary causes of kidney disease is hypertension. Hypertension is related to a good diet. So if we don't choose a good diet and we decide to make it, it's okay to have, go out to eat every now and then. I would say in moderation. But if we choose